Hey, this is Doug Field, CEO of the Institute for HealthCare Consumerism, along with my co-host Brent Macy. And welcome back to this segment of HealthCare Consumerism Radio. We're very pleased to have one of the leaders in this business and one of the original founding companies around HSAs on the phone with us today. We have joining us today Dr. Stephen Neeleman, who is CEO and founder of HealthEquity, which is kind of the oldest and become one of the largest HSA trustees, now managing $1.2 billion in HSA deposits and partnering with over 2 million members, 23,000 employers, and 60 health plans. And Steve, it's a real pleasure to have you with us this morning. Good morning.
Good morning. Thank you for having me.
Yeah. How's it out in Salt Lake City today?
It's actually beautiful. It's going to be in the 60s, but there is snow on the mountains.
You have snow on the mountain. Okay, that's great. Well, Steve, for our audience, give them a little history on HealthEquity. Kind of, you had this vision in 2002 as HSAs were just becoming a reality, and kind of fast forward us from there to today, please.
Well, I'm a physician,
Yep.
And as I was going through my training, everyone I would speak with would say, you're going to be working for the government in 10 years. And that made me kind of, a little bit nervous, to be honest with you. And so I think that was in large part why I started the company. I felt like that America has a great legacy of coming up with solutions to very complex problems. And I think typically it's a combination of good government regulations that can allow for businesses to compete fairly, but then also it's the private enterprise that really drives the creativity. And so that was my goal in doing it. I had previously had some experience in the airline industry,
mm-hmm.
And then I went to medical school, and so I had this interesting mix, I think, typically of someone that had really spent time in the consumer world, and then I tried to marry that with my medical background. And so that was the beginnings of it. Started the company in 2002. Mm-hmm. We actually started as a medical savings account company, as you know.
MSA, yeah.
And then we're very enthusiastic when we heard the rumblings in Washington for health savings accounts, went out and did some lobbying, and we did what we could to help push the legislation through. So by 2004, we were ready to go.
Then you fast forward today with the help of Purple Power or Purple People, right? So tell me about Purple People, which is kind of looks like the cement and the glue that makes things happen there.
Well, I recommend a great book to all of your listeners. It's called The Purple Cow.
The Purple Cow.
By an author named Seth Godin, and we read that book early in our history. And the whole message behind Purple Cow is that if you want to be well accepted in any community, specifically the business community, you need to do some things that are remarkable. And so from day one, when we started answering the phones, we did it 24/7. We realized that a lot of folks that would be going into a new environment, health savings accounts, that they would be doing so without a lot of knowledge. And whether it was at 2 a.m. or 2 in the afternoon, when they had a question, we wanted to be there for them. So that kind of started this remarkable approach to customer service, and we've continued it to this day. And I'm happy to tell you that just through our interactions with our members, we'll answer over 1 million calls this year in 2013,
wow.
And actually over 25% of those calls will be after business hours or on weekends or holidays.
Now, Steve, when you're fielding all those calls, is there a couple questions that always come up, or is it a bunch of different questions that you guys kind of field?
Well, you can imagine a lot of the calls are just kind of the mundane questions around mundane questions around activating your credit card or debit card, or what's my account balance and things like that. But the more remarkable questions that come up is when someone calls us, oftentimes in the middle of the night, they're headed to an urgent care, or they're headed to a pharmacy, and it's the first time they'll ever have to use their health savings account, and they just don't understand it.
Mm-hmm.
And so to be able to kind of interact with them, sometimes they'll even put the medical professional on the phone, and because the medical professional, up until even now, I mean, as you know, with about 10% of Americans having health savings accounts or those types of plans, it's still not widespread like we'd all like it to be. And so they'll ask us, how does this work? And I can't tell you the number of times where when the phone goes back to the member, or even when our medical professional is on the phone with or our member services on the phone with a medical professional, they'll say, wow, that sounds like a great plan. And so it's really just helping people understand how HSAs work, how they can benefit from them, and how, even though they're a little different, the doctors are still going to get paid and probably paid faster than they would under the old type of plans.
Steve, we're in the middle of celebrating the 10th year anniversary of HSAs coming up here in December. We've got as part of this radio series, we're going to extend that into our IHC Forum West in December, and we've got a major feature coming out next week in our November-December issue where Roy and John Goodman and several have been interviewed. And, you certainly are a cornerstone of all of that. And I think there's a lot to celebrate. I think HSAs have come through, health reform a lot better than some of us thought it was going to be early on. And it's thanks to, companies and individuals like yourself, as well as Roy and Kevin and the team and many, many others. But we're still a very small piece of the whole pie, aren't we?
Yeah, we are. And, a lot of this is just people learning more about it. Mm-hmm. We oftentimes will compare the adoption curve of health savings accounts to 401ks and even HMOs. And I think we're doing okay if you compare it from that lens. On the other hand, when I go to these open enrollment meetings with these large employers, and even though it sometimes makes so much financial sense, it never ceases to amaze me when I ask how many people in the audience have ever even heard of a health savings account after 10 years, and very few hands go up. And so we need to do more to educate. I often think we should start doing some public service announcements or something, because it truly is the best way to save money from a tax perspective, and I think it almost needs to become more of a public awareness campaign than a marketing campaign, if that makes sense.
Steve, one of the things
that's actually very interesting, Steve. Sorry, Brent.
One of the things that Doug and I have talked about before and would like your opinion on it is should the employer, if they're going to offer an HSA with a high deductible, should that be the only plan in a lot of instances? Not to, I know they want to provide choice, but sometimes people fall back to their old ways and go with what they're more familiar with.
Yeah, we actually have about, you mentioned in the intro, over 20,000 employers, and so we see it on all sides of this coin. And a good portion of those 20,000 plus employers are full replace because they're small businesses. And if you work for a small business, you're kind of all in it together. They're all in the same lifeboat. Yeah. On the other hand, the larger businesses tend to be less inclined to go full replace, and they do offer a lot of options. I think in doing so, sometimes just because of inertia. I think I think inertia is actually Newton's first law, and it's really, really prevalent in health benefits, right? Yeah. People just do what they've done for the last 10 years, often to their financial detriment. And so I think that if an employer wants to offer choice, and by the way, we do have some very large employers that have been full replace as well. So I think that if an employer wants to offer choice, they really need to focus on educating people. Otherwise, they're actually doing their people a disservice. And so if they're unwilling to take a very active role in education, then I think they probably should just go to a full replace.
Yeah, I think that's right. We were in some meetings this week in Minneapolis. I've been talking to some employer groups as well, Steve, and I think that, kind of the single comment coming out of these meetings is that employers are getting out of their seats probably faster than they ever had, say we've got to do something. And many are looking at private exchanges. I want to get kind of your feedback on that in a minute about private exchanges and public exchanges, the impact on HSAs. But the other message I hear, and I actually see it, is a lot of major employers have been on a 3-year strategic plan, and that 3-year strategic plan is leading them, this fall in 2015 to a full replacement HSA program. I think they are saying, hey, that's the direction we need to get our population.
Yeah, and so that's consistent with what we've seen. We're probably bringing on at least 50 employers this year that are, let's call it 5,000 or larger, or maybe even 10,000 or larger. Mm-hmm. And, it's a great year for us, but it is interesting because I spent a lot of time, and these are tech firms, hospital systems, retailers, and they're all saying the same thing. By 2016, we need to be full replace or pretty much full replace. And I think the reason for that is the data has come out of the National Business Group on Health and some of the other consulting firms that if you can get over half of your people in a health savings account plan, your total cost per your employees is going to be down by 10 to 20%, which is a remarkable statistic. And so that's why they're doing this. Now, on the private exchange side, we can talk more about it. I think that that's a way for employers to wash their hands a little bit of the benefits. I think there's good and bad for the HSA movement. I think the good side is that when people are given a defined contribution and they send them to some sort of marketplace, a private exchange, they tend to buy HSA-type plans a lot more commonly than they would otherwise if they were just put in a regular benefits environment.
That's interesting. Steve, we got about a minute and a half to go. This time really flies, and I really enjoyed your time with us, and we could spend 30 to 40 minutes talking with you on this radio program about this. But I want to give you a chance to kind of leave our audience with, several takeaways.
Great. So I would say takeaway number one is that even in this world of health reform, HSAs are alive, they're well, they're strong, they're growing. And I think to the credit of the current administration or whoever crafted this legislation, we do not believe that HSAs are negatively impacted. We actually think with the Cadillac tax looming that these are alive and well. I think number two is that education is critical. And if people are willing to take the time, and whether it's in webinars or face-to-face or more of a direct-to-consumer approach, that if people can just understand that I have great faith in the American people, they'll say, yeah, this is a wonderful opportunity. And then I think the last thing I would say as a physician is there's nothing more rewarding for me than when a patient comes in and they're actually in a health savings account plan and they're sitting in front of me in the exam room and they actually are engaged in their health care. And they just want to make better choices. It's kind of like the lidocaine numb that's of a copay plan that they've had for 20 years is now gone, and they're willing to kind of wake up and ask better questions.
Steve, listen, I really, really appreciate your time today, and hopefully you can find some time out of your busy schedule and join us out in Las Vegas at IHC Forum West. Would enjoy seeing you there, and enjoy your weekend, and thanks again.
Thank you, gentlemen. Take care.
To the rest of our audience, stay tuned for the next segment of HealthCare Consumerism Radio.
Hi.